Hello, everyone, and welcome to the Medicare 101 presentation held by AAA. I'm Sarah there on the left for you. I'm here with Karen.
Hi, everybody. I'm Karen from Buffalo.
And we're here to help you solve the Medicare puzzle. Now, you might be asking yourself, why is AAA in Medicare? Well, we saw it was complicated and that there's a lot of different paths that you have to take as you age or as your situation changed. So we decided we wanted to be trusted advisors for our community and making sure everyone knew how to use their health care.
Well, and Sarah, it's great that we're able to offer this not only to help everyone understand Medicare a little bit better, but not only that, we're licensed Medicare consultants in the state of New York, and we're contracted and certified to represent a number of the Medicare health insurance carriers. So we can do the shopping for our members, or even if you're not a AAA member, but definitely for our members. And because we're brokers, we represent our AAA members. We're not beholden to one particular Medicare company. We're able to do the shopping for our members based on what their needs are. So that's another reason it's great to be a member of AAA.
Yes, absolutely. So a couple of the topics we're going to talk about today. We're going to start with enrollment periods. With Medicare, you can't sign up, whenever you feel like you have to wait for a specific enrollment period. We'll talk about Part B penalties and how to avoid them. Talk about physician networks and prescriptions and how those are important. And we'll finally talk about Medicare Advantage and Medicare Supplement plans. What are they and how to compare them? First things first is when to enroll. If you are turning 65 and you've gotten a barrage of mail recently, this is why you are in what's called your initial enrollment period, or an IEP. The 7th month window. It starts 3 months before, includes the month of, and 3 months after your 65th birthday. So you have 7 months where you're allowed to sign up for Medicare for the first time. Every year, between October 15th and December 7th, you have what is called the annual enrollment period, or the AEP. This is when all Medicare beneficiaries can add, change, or drop their Advantage plan, Part D coverage, or their supplement coverage. So this is really where you get to take control of your health care every year once you're in the Medicare system. You want to compare year over year to make sure you're in the right plan. Just kind of like car insurance. You don't stay in the same car insurance plan year over year. You switch out, you save some money. So this is where you get to do that. There is also an open enrollment period, also known as a Medicare Advantage open enrollment period. This is between January 1st and March 31st. This isn't very well known. You won't see the commercials, you won't hear it on the radio, but anyone with an existing plan can change their coverage. So you get to January 1st, you realize you don't like your plan, but you already have one, you can actually change as long as you hit that before March 31st. The next enrollment period we'll talk about is kind of a group of enrollment periods. These are special enrollment periods, or SEP, and these are triggered by events. That's the best way to think about when these would come up. Some SEPs include moving out of area. If you have a plan with a network, moving out of area gives you a special enrollment period. Retirement is another special enrollment period, and it's a very big thing with Medicare. So I'm going to take the time and say that if you're interested with information regarding Medicare and retirement, we have a whole webinar. Go ahead and sign up for it. We'll talk about that there because we could spend another hour on that. But right now we're going to stay on the 101 and talk about, just the basics. So if you need more information about retirement, look for that other webinar. Otherwise, those are your enrollment periods. The next step is to kind of talk about it. You hear about the alphabet soup, A, B, C, G, right? So let's kind of identify some of those pieces for you and who handles what. Original Medicare is Part A and Part B. Part A is hospital care. I want you to think of this almost as a hotel bill for the hospital, whereas Part B is your medical care. And really, Part B is 80% of your medical care. It leaves a 20% coinsurance that you're responsible for. We'll talk more about that in just a moment. So together, A and B are original Medicare, and they are handled by the Social Security office. Both of these will show up on your card. There's examples over there on the right for you. But when you start your initial enrollment period, you can go to Social Security and sign up for your Parts A and B and get, on Medicare path. Here are some of the costs involved with both Parts A and B. What I want you to remember about Part A is for most people, it's an entitlement. If you have paid into the Medicare tax for 10 years or 40 quarters, you get Part A without a monthly premium. So it is called an entitlement because you've already paid for it. If this is not you, come talk to us. We can help. It doesn't cover everybody, but it does cover the vast majority. So if you, and I should also say, if you or your spouse have paid in those 40 quarters, Part A will come to you as an entitlement. Part B, for most people, will cost $148.50. That is the 2021 monthly premium for Part B. There's also a yearly deductible of $203 with Part B. If you see right there, the third line down, it says Medicare will only pay 80%. So A and B only covers 80% of your medical costs. Those are your physician services, your speech therapy, diagnostic tests, durable medical equipment like wheelchairs and the like. All of that is only covered up to 80%. So 20% of a regular doctor's visit, well, that's not that bad, right? But 20% of a hospitalization can be. And with just A and B, there is no stopgap. There's no maximum that you will pay out of pocket. You're responsible for that 20% coinsurance. That's where your Medicare Advantage and your Medicare Supplement plan come in. So we'll go over those in just a minute. But again, these are the costs for 2021 for Part A and Part B and what they cover. So we just talked about Part A and Part B. I want to talk quickly about Part D as in dog, or actually as in drug. The Medicare prescription drug coverage, Part D, is really a government mandated level of prescription drug coverage that they expect all individuals over the age of 65 to have. Now, it's important to have this to avoid lifelong penalties. Both Part B as in boy and Part D as in dog come with late penalties if you don't sign up in time or you don't have what is called creditable coverage. If you are looking into Medicare, as long as you are in your initial enrollment period, you will be able to avoid these penalties. So that's why it's important to sign up for all of Medicare at the right time. Karen and I talk about this all day. Some people aren't sure when they want to retire. Some people aren't sure if they want to do it right at 65. Let us help you identify at least a timeline so you know what to do to avoid these penalties. So I throw Part C on this slide here just to kind of talk about how that is separate from A, B, and D. A and B are from Social Security. Part D, again, is that drug coverage. Part C is just a type of plan. It's actually the carriers offer Part C plan. Those are your Medicare Advantage plans. It takes certain parts of A, B, and D, wraps them all together in one nice big bow. But in order to get a Part C, you do need to have Part A and Part B.
Or it bundles everything together, like we hear on commercials. Bundle your coverage.
Indeed. Bundle your coverage, yes. Well, speaking of Part C, Karen, I believe this is where we hand it off to you.
Okay. All right. So here, let's talk a little bit about original Medicare Parts A and B. So you've got your Medicare card, and once you have Part A and Part B, you have your Medicare card, there are two options available to you, and you can see them here on this screen. You have the Medicare Supplement Plan, and with a Medicare Supplement Plan, you will also need what's called a Part D drug coverage plan, or there's the Medicare Advantage plan known as Part C. That's the one that bundles A, B, and D together. All right, and we can go on to the next screen, Sarah. All right, so let's take a look at the Medicare Supplement Plan, and we'll give you an idea of Medicare Supplement and Medicare Advantage, and you will decide between a Medicare Supplement or a Medicare Advantage plan. You can't have both. You can only choose one. All right. So let's talk about Medicare Supplement Plan first. The one thing that's great about the Medicare Supplement Plan is that it is very flexible in that it's a plan that truly follows you wherever you go in the United States. There are what's known as no networks to the plan. So as long as you are seeing a provider or going to a facility that accepts Medicare, if you have a Medicare Supplement plan, that plan will be accepted throughout the United States. All right. There's what's known as a guaranteed renewability, as long as your premium is paid. So as far as the premium is concerned, again, as Sarah mentioned, you'll have the $148.50 premium for your original Medicare Part B. And then you'll also have a premium that you'll pay for your Medicare Supplement plan. All right. The coverage is quite comprehensive. Benefits don't change in this type of a plan. This is a type of plan that you can keep with you. And again, it's very comprehensive. It provides minimal or no out-of-pocket healthcare related expenses. So if you like paying more upfront for your medical services and not having to worry about co-pays or co-insurance or a lot of deductibles, a Medicare Supplement plan could be very advantageous for you, very beneficial for you. Keep in mind, though, with a Medicare Supplement plan, you'll need Part D, standalone prescription drug plan. And this Medicare Supplement plan will pay for the 20% of Medicare expenses, of medical expenses, that original Medicare does not cover. So original Medicare is 80%. Your Medicare Supplement plan takes care of the remaining 20%, and then you need an additional prescription drug plan for your prescription medication. All right, Sarah. So let's go over to the Medicare Advantage plan, the Part C, which bundles everything together. So these plans cover all the medical and hospital services that original Medicare covers, except for hospice care. These plans may cover additional benefits such as the supplemental dental, preventive dental, routine vision, hearing. It also has gym memberships that are available, and not really even so much memberships, but these cards will allow you to go to any of the gyms that accept these cards, and so many of them do, and you can just walk in, take care of going to any type of activity that they have available. You don't have to worry about joining. So that's another benefit available to you too. One other thing that's nice and becoming popular are the medications, the over-the-counter medications. So many plans are even offering allowances for over-the-counter medications that ordinarily, such as Band-Aids or other type of first aid items, vitamins, minerals, even toothpaste or anything like that. Instead of paying for those out of pocket, you are provided you're provided an allowance throughout the year, and instead of paying for them out of pocket, you can buy them through their catalogs. These plans are more closely resemble the ones that you may be more familiar with the healthcare that you had through your employer. It's different than a Medicare Supplement plan that has no networks. These do have networks. There are HMO plans, so you'll have a home network that will cover a certain region. There are also PPO plans, and those PPO plans, you can get coverage as you'll still be provided care outside of your home network, but you will be paying a higher percentage of the cost. So, but again, one advantage is that you pay as you go. It's different from the Medicare Supplement plan where you're paying more upfront. Here you pay as you go. And for those members who are very healthy, have very little to do in the way of prescription medication, these plans can be really great plans for you. And the costs are different than they are with the Medicare Supplement plans. So make a call to talk to me or Sarah. We'd be glad to get into costs and provide quotes for you so you have a better idea of which option you'd like to choose. So here we go. You can compare your options a little bit. Medicare Supplement on one side on the left and Medicare Advantage Part C on the right. So take a look for just a little bit and get an idea of what's available. So 0 to low out-of-pocket expenses when used on the Medicare Supplement side. Typically lower monthly premiums for the Medicare Advantage. The no networks is definitely a good feature of the Medicare Supplement. Prescription drug programs are included with the Medicare Advantage plan. So I don't want to go back and forth too much and confuse you, but take a look at those coverages there. And again, Sarah and I will be happy to help you further. So just give us a call and we can go on to the next slide, Sarah. All right, let's talk about the prescription drug coverage. And you know, everyone, this is what is really important. I'm sure all of you know just how crazy some of the prescription drug costs can be. I don't know if you've ever stood in line just kind of holding your breath, waiting to see what your co-payments are going to be when you go to the pharmacy. I know a lot of people do, and I have as well. A prescription, the type of prescription medication that you're on can really make or break a Medicare plan for you. And that's why it's important to reach out to someone who knows. Go to the Medicare experts. Call me, call Sarah for an appointment, and this is where we can help you choose a plan that is based on your needs and the medications that you're taking.
Karen, if I could.
Yes, please do.
This is where I spend the majority of my day, guys. We got to make sure that your prescriptions are going to cost you the least amount of money, because this is really what runs a lot of the costs. So I go in and Karen goes in and we, just because it's a generic with one carrier, it might be a preferred generic with another, and it might not even be covered. So
right.
This is really, really monumental when it comes to choosing your plan.
Right. And thanks for pointing that out, Sarah. That's important, everybody. If you're working with someone who's trying to enroll you in a Medicare plan, if they are not asking you the prescription medications you're taking, be careful because this is what will really make or break your plan. And it could cost you hundreds of dollars more a month. And we're not trying to scare you. We're just trying to educate you as to some of the challenges with not so much with Medicare, but with the prices with prescription drugs, because they're not all the same. with every company. So
Well, and
let's just,
another point,
yep,
Karen,
yep,
just because Susan down the road loves her Medicare Advantage plan, if
mm-hmm,
your drugs aren't covered on that plan, it's not the right plan for you. So
right.
that really dictates it more than what the benefits offer. The benefits are, I don't want to say standard, they're pretty close across the board. It's really what your prescriptions are going to cost.
Right, right. Exactly right. Thanks, Sarah. And for those of you who aren't familiar with the prescription drug tiers, I'll go over those for you really quickly. And look at the costs. See the dollar signs, the cost on the right-hand margin there, the right-hand side. So there are 5 tiers when it comes to prescription drugs. All right. Tiers 1 and 2, if at all possible, stay in those tiers. Those are the generic medications, and they cost the least amount. Preferred generics, and then tier 2 are the generics. Tier 3, prescription brands, that's pretty much anything that you would see that is advertised on television, for instance. And that's where it can start getting a little, I don't want to say tricky. It's not tricky so much as this is where you want to know which carrier has their preferred brand medications at the best price for you. Because some carriers might consider a preferred brand a tier 3. Others might consider that very same drug a tier 4, and the difference in cost you can see there. That can amount to hundreds of dollars a month. Sarah and I can help you avoid those pitfalls. That's one of the potholes there
Yep.
that Sarah was talking about in the beginning. And then your specialty drugs, the specialty mixes that you may have, those are tier 5, and those are the most expensive. So that gives you a little idea about the prescription drug tiers. All right. And we can go on to the next slide, Sarah. All right. Have you ever heard anyone, you're talking with friends, relatives, and have you ever heard them talk about they're in the donut hole and they're not acting very pleased about it? Well, it's because it's not like if you're in the Buffalo area, you would know Paula's Donuts, but this has nothing to do with those great Paula's Donuts. Or any other kind of real life donuts, by the way. If you're in the donut hole, you're also in what's known as the coverage gap. So let's talk about that. A number of people won't even go into the donut hole or the coverage gap, but some will. So let's talk about that just a little bit. The Medicare plans, they recalibrate every year. So January 1st, we all start all over again with Medicare plans. You can keep your plan. You don't have to do anything. Keep your plan and it'll roll right through into the next year. It all recalibrates back to zero, and you will be in the initial coverage phase of your prescription medication plan. And in that initial coverage, you will make your copays, and the plan will pay the remaining prescription costs until the total retail drug costs reach $4,130. Now, for many people, they're never going to reach that $4,130 in 1 year, so there's no issue. However, some people will, particularly if you're on a lot of tier 3 brand name medications. For some, you might even go into what's called the coverage gap within 3 or 4 months. March or April, some might already be in the coverage gap. But again, you won't reach it until the total retail cost of your medications totals $4,130. All right. When you get to that point, then you're in the donut hole, or what's known as the coverage gap. And when you're in the coverage gap, you will be responsible for then paying 25% of all your prescription medication. All right. Your copays go away and you're paying 25% of the retail cost of brand names and generic drugs. And you will stay there until you get to the point that your total out of pocket costs are $6,550. Once you reach that amount, $6,550, then you go into what's called catastrophic coverage. And really, that's the good part because it's not that catastrophic. However, you've reached that level, and once you've exited then the gap, you will be paying $3.70 per generic, or $9.20 per brand name prescription medication, or 5% until the end of the calendar year. So not everyone will have to worry about the donut hole or the coverage gap, but for those who have high drug prescription drug costs, that gives you a little bit of an overview of what to expect each year. All right. And again, it underscores too what Sarah said, that most of our time is taken up tracing and tracking all of your particular prescription medications to see which carrier has the best for you.
There was one I was working with last week where carrier A had her in the donut hole by May, but by, using a different carrier and using a different pharmacy, we actually didn't get her in the donut hole until December, and it was
Oh,
much more, advantageous for her. So if you don't hit it, it's, if you, a lot of people, as Karen said, are not going to hit this, but if you know what this is, you want to stay out of it, and that's where we really can help.
yeah, yeah. And for that member, Sarah, who you helped, if they didn't know that going into it, and whoever they were working with didn't check that, that can cost them hundreds of dollars more, and it's unnecessary. So you just
Yeah.
need to know to go to talk to a Medicare expert.
Right.
So what are the next steps? Well, the next steps, everyone, give us a call. Another thing to remember too is the health situation that you have today may not be the same in the future. So Sarah and I can help you in the event that you have some life changes so that we can help you go from one plan into another. But again, you need to be educated as to what to do. And Sarah and I are happy to talk to you. Here's our contact information. So set up an appointment and talk with us. We'll take you through the whole process from enrolling into original Medicare to enrolling into a Medicare plan, and then going through and re-enrolling every year, whatever it is that you'd like to do. But my information is over there on the right. I'm Karen Anderson. And Sarah, anything else you'd like to add?
Yep, I'm there on the left for you. Give us a call, guys. If you have any questions, if you're not sure, if you want to know what your options are, that's where we come in. And we're free to use for members and non-members. So we really hope that you got the information you needed today, and we hear from you. Thanks, everyone.
Right. Thanks, everyone. We appreciate your supporting us, and thanks for choosing AAA.